question. So what we do know is that LGBTQIA plus individuals seem to have a higher migraine burden compared to heterosexual cisgender counterparts, and a significant amount of stigma and a previous history of discrimination, often within the healthcare setting. So many of these patients often are either delaying, access to care or avoiding care altogether for fear of being judged or mistreated. And so many of these patients, by the time they reach a headache specialist, often have been dealing with their symptoms for years and without being treated, maybe further along in their disease condition or course, and maybe a little bit more difficult to treat, more frequent attacks, more disability. I mean, there are so many kind of aspects to this. And I think, they do have a unique, situation, especially in terms of prior stigma, because we know stigma can worsen migraine outcomes regardless of gender identity and sexual orientation. And then when you add the stigma of gender identity and sexual orientation to that, we don't have explicit data about this, but we suspect that it can kind of twofold increase, migraine burden and disability, which obviously can affect their ability to function, go to work, go to school. So it is a huge problem, and something that I think we can do a little better about educating providers and understanding what their unique needs are so that we can meet them in a better place to offer more informative care. One of the really interesting parts of this study was that we actually asked patients straight away, what could your providers do better or improve on to really help make this kind of a more inclusive care model and experience for you? And the majority of the respondents actually said that asking about preferred names and pronouns were one, quick way to kind of make patients feel included. Also, things like having signage around your clinic that shows acceptance, and having our LGBTQI plus patients see themselves in imagery, research recruitment studies, and so on. So just creating a safe space. We learned from other sessions through this AHS meeting that creating safe environments for these patients really can help kind of negate any of the gender minority stress that they're experiencing, which we think contributes to their migraine burden. So even just simple things as that. And for me personally, what I find is when I have patients in my office, really thinking about a way to partner with them in terms of coming up with a treatment plan that feels right for them, that they feel comfortable with. And that's really just allowing for an open dialogue and open communication about what their goals are, what they feel comfortable with, what they don't feel comfortable with, and really just kind of having a back and forth so that we both, feel like the next step makes sense and will be a good, kind of segue into, moving forward with your treatment plan. I feel really strongly about this, and I teach a lot of my residents, my students, and my fellows this, regardless of gender identity and sexual orientation. I think we as headache specialists have a very unique opportunity to create a therapeutic alliance with our patients that can be therapeutic in and of itself without actually adding medications to it, although many of us do. For a lot of patients with migraine, they often feel isolated and alone and feel like, many patients have told me they feel like they've kind of been pushed aside or discarded or kind of gaslit in some ways and saying, oh, it's just a headache, it's not a big deal. And, we have the opportunity as specialists to have them in our office and hear them and listen. And sometimes just being there in the space with them and allowing them to vent and talk about their frustrations allows them to feel heard. And that in and of itself can be incredibly therapeutic. And so having that open communication is really, really important, and something I really, really stress with my students and my residents and fellows that, sometimes you need to know when to kind of take a step back, stop talking, and let the patient lead. And also kind of think about subtle body language cues or, the tone of voice that they're using, and kind of see what seems comfortable to them, what doesn't. And sometimes it's just a matter of saying out loud, what are your goals for this visit? What are you hoping to get from seeing a headache specialist? Like, are you thinking about headache freedom? Are you thinking about improving your quality of life? Are you thinking about being able to go to social events or function at work? What are your benchmarks and what are your goals? And from your perspective, what do you think I, as your provider, can do to help you get there? And I think really just fostering a team-based approach is a really great way to do that. And especially for LGBTQI plus patients, many of them are kind of in this very hyper-vigilant state where they're constantly assessing their safety. And so if there's anything you can do to create a safe space for them, to allow them to kind of let their guard down just a little bit and be able to share, deeper personal kind of information with you, that's really where that connection lies. And I will say that it's hard sometimes because, especially for providers, I think we're always very concerned, like we don't want to offend anyone, we don't want to pry, we don't want to overstep. And sometimes it's just a matter of reading the room and knowing when to take a step back and, again, let the patient take the lead. But it is something that I think comes with practice and experience. And I think, anything that we can do to even just try or attempt, and, sometimes sharing, your experiences and just letting them know, hey, I hear you. This sounds really hard. Tell me what I can do to help make this a little bit better for you. Validating their feelings, I think, makes a big difference.